Welcome to Savitha Dental College Lecturecast. Today's topic will be in orthognathic surgery and we'll be seeing about the diagnosis, clinical examination and treatment planning. Orthognathic surgery is defined as the art and science of diagnosis, treatment planning and execution of treatment by combining orthodontic and oral and maxillofacial surgery to correct musculoskeletal, dento-osseous and soft tissue deformities of the jaws and associated structures. It is indicated in severe anterior open bite, severe dentoalveolar problems, severe class 2 and class 3 skeletal discrepancies, skeletal asymmetry, deep overbite in non-growing patients, and extreme vertical excess or deficiency in the maxilla or the mandible. The examination of such patients consists of four main parts, namely the examination of the TM joints, the examination of the frontal view of the face, the profile view of the face, and the intraoral examination. In the frontal view, the facial midline is noted, the tooth to lip relation, the head to body proportion, symmetry, facial contour and the lip length are noted. In a profile examination, the anteroposterior position of the maxilla and the mandible, the contours of the cheeks, the mandibular angle, the lip competence and the nasal size are noted. Intraorally, cross bites, overbite, overjet, crowding. Is there any dental midline shift? Molars and crine relations are noted and the curve of Spee and the curve of Monson are checked. The lateral cephalogram is the most commonly used radiograph to analyze such patients. The cephalometric analysis by Burstone in the year 1978 is the most commonly used orthognathic cephalometric analysis. The dentofacial deformities can be either maxillary deformities, mandibular deformities, or a combination of both maxillary and mandibular deformities. The patient's dental models are analyzed and the occlusion is checked, the dental arches, the position of the teeth, the size and shape of the teeth, and the position of the jaws in relation to the skull base are checked. Presurgical orthodontics helps in decompensating the occlusion and getting the patient ready for surgery. Prior to surgery, a mock surgery is done where the amount of movement which is required in the patient is simulated in the dental cast fixed to an articulator. After the mock surgery is done, a splint is fabricated which is used in the patient during the surgery. Presurgical orthodontics also plays a very important role. Here we see a case which has undergone surgery and pre and post surgical orthodontics. The difference is well noted and the final finishing and settling is obtained in the post surgical phase. So, once a patient comes, we take a history, do the clinical examination and collect all of the records. Once a diagnosis is arrived at, the patient is either taken up for an orthodontic treatment or a surgery and orthodontic treatment is planned in a combined fashion. Thank you.